I think a really important topic for us to address and talk to the broker and agent community about is when you're selling Medicare Advantage plans or any even ACA plans, so any type of health insurance plan that's network based. So whether you're selling, ACA, that you have an HMO plan or a PPO plan or Medicare Advantage, and something's network based, just understand that with the way that healthcare is evolving, rarely are you going to find a plan that just has this broad network and encompasses every single doctor and hospital. And one thing that's been very frustrating for me to observe is that many brokers, because they're not well trained and they aren't having a great conversation with their clients, they skirt or avoid being really transparent in the doctor and the hospital and the discussion about access of care. So we talk about access of care being absolutely critical to any broker who's selling any of these healthcare products. You absolutely should be asking your clients, do you have a primary care doctor? Now, I will say some brokers have a broken mindset and go, oh my gosh, this person has a doctor, and because they already have an established primary care doctor, if I don't find a plan that's in network, then I'm just done. That's not always the case. And so I think it's important that the broker is asking the question to say, do you have a primary care doctor? And the follow-up question being, is it important for you to be able to continue seeing that doctor? And some people are going to say, absolutely, I've been seeing this doctor for 20 years. Other brokers are going to say, you know what, I've only seen them once in the past 6 years. So, I'm open to changing. That's great. Have the dialogue and have the discussion. And if they're flexible and willing to be open to change, it gives you a lot more options as far as providing them with new plans to recommend. Okay, so keep that in mind. Don't avoid, and you need to also ask them about specialists that they're seeing, and be very clear. If you had a client that said, hey, here's my PCP and here's my 4 specialists that I go to, it's perfectly fine to say, look, I've scoured, I've looked, there's not a Medicare Advantage plan or an ACA plan that encompasses that full entire network. Which of these doctors would you be willing to switch or try somebody new? And then maybe there's one of those specialists that they're willing to compromise on, and then you can find them a plan that works. And so I think that dialogue needs to happen. It's important. Don't skirt it. Don't just put them on a plan and then discover 3 or 6 months later that they're having access to care issues, because they are going to file a complaint. It is going to be a CTM. It is going to come back to haunt you. So, but again, I think people appreciate the transparency, the honesty, and if you conduct that conversation in the right way, you're going to be an even more valuable asset to them, and they're going to appreciate your honesty.